The eye is one of the most sensitive organs of the body. It is also one of the most used and often taken for granted. Experts often remind us that the eye requires attention and care, which the average person hardly gives to it. And recent statistics indicate that eye ailments and diseases are on the increase on a daily basis, not only among the elderly, but even among children of primary school age. One of the eye conditions prevalent is cataract, which comes with cloudy vision, poor visuals at night, and sometimes double vision. Glaucoma is another one which has to do with the damage of the optic nerve, and experts say the danger is if it is left untreated, it leads to blindness. The proportion of avoidable blindness is high, with half being attributable to cataract alone and uncorrected refractive errors being responsible for 57% of moderate visual. This means that appropriate and accessible refraction and surgical services need to be provided. The prediction is that if priority attention is not given, the number of blind and severely visually impaired adults in Nigeria will increase by 40% over the next decade. This, you will agree, is distressing, and the eye situation in the country undoubtedly calls for proper sensitization of the populace on proper care of the eye. On Nigeria Today, how to take proper care of the eye is our focus. My name is Kande Daniel. Glad to host the midweek edition of the program. Welcome. The matter of proper care of the eye is serious business, so we have two professionals in the studio. Dr. Ozi Okonokwa is the President, Nigerian Optometric Association. Welcome, sir.
Thank you very much.
Dr. Orwell Maduakolam is a member of the 2018 World Sight Day Planning Committee.
Thank you very much. It's my pleasure to be here.
Welcome. Well, like we hinted already, the eye, we all know, very important, but we ordinary people hardly give it attention. It's not one of those things you wake up in the morning and say, okay, I need to wash my eyes, I need to oil my eyes, I need to protect my eyes. We don't operate that way. So we are glad you're here today on Nigeria Today. How exactly, if I may begin with Dr. Orwell Maduakolam, how should we take care of the eye?
Thank you very much. It is a question that we have to ask ourselves every time, because just like you said, the eye is a very important part of the body, is a very important organ of the body. In fact, 80 to 80% of what we do every day depends on how much we can see. So how do we take care of our eyes? Number one, it's important we see an eye practitioner from time to time. If I am above 40 years, I should see my eye doctor at least once every 2 years. And if I'm above 60 years of age, I should see my eye doctor, an optometrist, once every year. And if I am below 40 years, at least I should see my eye doctor every other year. Again, it is important to also understand that eye care is simple. Some persons, when they have eye problem, they resort to self-medication. It is wrong. If you notice anything in your eyes, what do? Go and see your optometrist. Don't resort to self-medication. Some persons will say, use urine, early morning urine, put into your eyes, it will cure all the eye problems. Some persons will say, use get leaves, local herbs and put into your eyes. I've also heard recently some persons even use the breast milk. They say, use breast milk and put into the eyes, it will solve the problem. None of these things are good. They cause more harm to the eyes. So it's important you see the specialist to take care of your eyes, because the eyes is not like the ears and other parts of the body that you should just play with, and they are delicate. Do you understand? So that's why you need to take care of the eyes. See the optometrist to examine you to be sure your eyes are good.
Right. Dr. Okonokwa, in between the 2 yearly visits to the eye specialist, are there any, habits you think we should form as ordinary people to take care of the eyes on a daily basis?
Well, thank you very much. I think Dr. Orwell has addressed some of the major issues we need to do in order to take care of the eyes very well. But I would just need to add that the eye is perhaps the most exposed organ that we as humans have, and that predisposes it to a lot of environmental hazards, and that also makes it very vulnerable to a lot of dangers that we face as human beings. In our normal day-to-day activities, a lot of things the eyes can be exposed to a lot of things, and for us, the biggest challenge we face is amongst those active children, and those that are just growing up. You want to, as much as possible, avoid hazardous conditions that may, affect the eyes. We normally advise children, because those are a very vulnerable group, advise them to stay away from the use of sharp objects, pencils, broomsticks, and other things that may, impact negatively on the eyeball. Another thing that we should do, as far as protecting the eyes are concerned, is to observe very simple personal hygiene. Most times, because we see with the eyes, I can see my hand, I can see my leg, and it's the organ that makes me see them. I normally ignore them because they are just there. You don't observe, you don't notice the eye. So we should, as a matter of fact, observe very simple personal hygiene as far as the eye is concerned. And then those who tend to smoke also predispose themselves to a lot of ocular related hazards. So eating habits, smoking habits, different lifestyle makes you easily prone to some eye conditions. And I will not fail to add to the fact that, just like in your intro, you talked about glaucoma. This is a disease condition that gives no warning sign, and the patient does not know anything is happening, and so they walks around as if the eyes are healthy and normal. And so the key there is early detection for such conditions. So
okay, we will talk about glaucoma in a short while in details, but I was curious. I know that a lot of times people wear sunshades to protect from the sun, supposedly. Does that make any meaning or any sense in terms of protecting the eyes?
Oh yes, it does, if those sunglasses are prescribed. It is not everything that shields the eyes, that is dark, that is actually shading the eyes from the harmful rays of the sun. The sunglasses are actually designed to screen some rays, that comes from the sun from getting into the eyes. But when you pick up just any pair of dark glasses, you're actually opening up the window of the eye, because once the eye is in a dark environment, the pupil becomes wider. And that wide pupil allows a lot of light to come in. So if you have not screened away the harmful rays of the sun, you're only introducing more rays that probably will harm the eyes into the sun. So the key and operative word there is to only wear sunglasses that are prescribed by professionals. You don't walk along the roadside and pick up just any sun rays. Sunglasses. There are some sunglasses that actually have what we call UV protection. And that's the ultraviolet rays from the sun. Now, if the sunglasses that you're wearing does not have that component, you discover that the pupil becomes wider because you've screened away, the light, but now allows in some harmful rays that will cause you more damage. So it's not just enough to wear sunglasses. You must be wearing the correct and prescribed sunglasses.
Well, this is news actually, because we used to think that the kind of glasses that you professionals insist we get from you is the reading glasses and other lenses. So what about that?
And no, we do. There are a wide range of glasses that are lenses that are prescribed. Sunglasses are just one part of it. There are reading glasses. There are glasses that actually help you see better at far. There are some that help you see better at near. There are some that we call relieving lenses. They don't necessarily improve your vision, but they give you comfort. Because seeing is a process that involves both comfort and vision. So you may see clearly, but you're not seeing comfortably. So you can also be given a pair of glasses that will enable you see more comfortably, and eliminates other symptoms that you may be having. So it's not just enough to give you, we don't just talk about sunglasses alone or reading glasses. A whole wide range of lenses that were prescribed.
So we do need professional advice all the time.
All the time.
Concerning the eyes.
All the time.
Okay. Dr. Maduakolam, let's quickly now talk about the common ailments, eye ailments that that you want us to know about, and then the bigger ones.
Okay, thank you very much. In your intro, you mentioned cataract, you mentioned glaucoma, of course. These are the leading causes of blindness worldwide and even in Nigeria. Cataract, of course, leading amongst other causes of blindness. Cataract is the one people commonly come in contact with. You see somebody having eye problem, the eye is not seeing at all. And of course, people can see from a distance that your eye, something is happening to your eye. And you say, okay, you're not seeing properly and all of that. So go and see an eye doctor. Of course, the glaucoma we know is one condition that people don't notice they have it. Usually glaucoma, blindness due to glaucoma affects vision from the sides. So the patient will not notice his eyes is not seeing, the eyes are not seeing properly again. Because the loss of vision starts from the sides. So it causes what we call gradual loss of vision from the periphery. So we'll call it the sneak thief of sight, because the loss of vision is gradual, so subtle that the patient may not even notice something is going on in the eye. So that's glaucoma. The glaucoma is one disease, eye condition that affects the optic nerve you mentioned, and it causes irreversible blindness. As a matter of fact, glaucoma is a leading cause of irreversible blindness. Usually before patients present to the clinic, they would have lost up to 70 to 80% of useful vision. And at that point, little or nothing could be done. What we try to do is to preserve the residual vision left. So we have cataract, we have glaucoma. We also have the common one people even neglect, refractive error. It can cause a lot of problem. People have, you have short-sightedness, you have long-sightedness. Of course, we have astigmatism. Commonly amongst children, people, we have a practice in this part of the world that don't allow your child to wear glasses, because if your child starts wearing glasses early enough, before he gets to adulthood, he would have been blind. That is a myth that we have to correct. Wearing glasses at that early age, if recommended, prescribed by a professional, is good for the eye health of the child. Because if you can correct the error at that time, you can prevent visual impairment that the child might suffer later in life. Exactly. Of course, we have also other eye problems. We have the common one people see, we call conjunctivitis. We have red eye. People present with red eye. That's the one people know commonly. Some persons call it Apollo. So you have red eye. You also have what we call macular degeneration, which are also causes of blindness. The central part of the eye we call the macula, usually it's destroyed. Some can be caused by old age, and some can also be caused by some other conditions or problems in the eye. So we have macular degeneration, and you have some other causes of blindness. But these ones, cataract, glaucoma, are the leading causes of blindness. Of course, eye infection generally can also portend problem to the eyes.
All right, before we take a break, Dr. Okonokwa, can you tell us, it's curious, because we hear that the rate of these diseases leading to blindness is increasing. Why?
There are many factors that will lead to an increase in the rate of blindness, or this disease being the apparent increase. One is increase in reporting which is a factor, which is as a result of the awareness creation that we've started doing recently. You know, a lot of Nigerians are becoming more conscious, so they come up, you know, and report this disease condition. Another one is the current economic situation that we're facing now, and that predisposes people to seek help outside the regular clinic. You know, a situation where, because of the increase or the reduction in the pocket strength of the average Nigerian, instead of coming early to seek help from a professional, you know, they do self-medication, or you apply traditional eye medicines, which are usually very harmful practices. So that's some of the reasons why there's an apparent increase in the number of people now reporting with different types of disease condition. But we must not also overlook the fact that globally, 80%, you realize that 80% of diseases that are leading to blindness are found in developing countries, and Nigeria is one of such. And I dare say it's even beyond 80%, because we are only able to pick those that are predominantly in the urban areas. Those in the rural areas really do not have access to, you know, quality eye care services, and they are the ones that are highly, you know, facing these conditions currently.
And are underreported.
Yes, they are underreported.
All right, we'll continue this discussion in a short while. The program is Nigeria Today, and the focus is on care of the eye. We'll take a few minutes to bring you the thoughts of a cross-section of Nigerians on the matter. Stay with us.
I normally take care of my eye, though I don't visit the eye doctor, but I do eat what to keep my eyes healthy and my eyesight functioning very well.
I think I have not seen that. I've not done that before. I've not done that. Since I was born, I've never gone to see eye doctor, and I don't pray. My dad, when he was alive, never used glass till 80 years of age, and I pray I am going to be like that.
I have never been there before. Because I don't have eye problem.
Is it all about until you have eye problem before you see results of your eye doctor?
To me, yes.
To check, I do go for eye check every 6 months. It's been my system, so I normally do it every 6 months.
So when was the last time you did this check?
Today, at the National Hospital.
It's over 3 years. I went to Kano, that's the Equa Eye Clinic, to test my eye.
So what was the result like?
It was okay.
So after 3 years, is it important going back to check?
No.
I'm glad you're still there. The program is Nigeria Today. We're talking about care of the eye. And the experts, Dr. Ozi Okonokwa and Dr. Allwell Madakalam, are still here. Gentlemen, I caught you laughing when we were taking those responses. Dr. Madakalam, what was it?
You know, the one that caught my attention is the person that said my dad didn't go to any eye clinic, didn't have any reason, need to check his eyes, and he was still seen at 80, and I don't have any reason to check my eyes. I've also seen a number of persons who say, because my dad didn't use glasses, I don't need to use glasses. They also forget the fact that perhaps their parents didn't do much of what they are doing now. Our parents didn't get to read as much as we're reading. They were not exposed to technologies we have these days. You have phone and all of that. And so they didn't have so much to do with their eyes. And currently, we have a lot to do with our eyes. If you're not using if you don't read, you have your phones to operate. You have other accessories, technologies to, use your eyes with. So the truth is that it's important you check your eyes regularly. The one I mentioned earlier about glaucoma, it doesn't come with any warning sign. It won't give you any reason to go to check your eyes. Some persons also don't understand that there are also other conditions of the eyes that they don't also present with any threatening symptoms. So what we advocate for, regular eye check. Because 70 to 80% of the cases of blindness are preventable. What do you mean by preventable? We can actually prevent blindness from some of the cases of blindness if detected early enough.
All right.
So that's why we talk about go early detection.
It's strange that much as you professionals are emphasizing the importance of visiting the specialist, it's obvious that people out there don't think it's important. Dr. Okono, is it possible that this is related to the tendency amongst people to be confused as to who to go to when they have eye problems or when they need advice? Some people don't know. Ophthalmologist, optometrist, what's the difference?
Before I talk about the difference in those cadre of eye care professionals, I just want to say this. The average Nigerian has a very poor health-seeking behavior. It has nothing to do with whether he's seeing an ophthalmologist or an optometrist. Naturally, we do not think that we should seek health. You know, health is something you actually look for. You need to seek it. It's the absence of disease.
Not only looking for solution to a health problem.
Exactly. The absence of disease doesn't mean you are healthy. You know, it's a complete package, and that is why from the report you discover that most Nigerians do not even understand that the fact that I am healthy or I am apparently not ill does not connote the presence of total health. I want to also quickly say that, granted that some of us were lucky in their growing up days, where we had exposure to different conditions that did not predispose us to dangers of health. You may have longer lifespan, or you're healthy, your eating habits at that time probably also gave you opportunity to have a healthier lifestyle. And so you may find somebody, his dad, perhaps the smallest thing his dad was seeing there was probably a tuber of cassava. You know, and because as a farmer, everything you are dealing with is big and massive, so you don't have need for finite details, which is what we do currently. So I hope his prayer is answered, that he doesn't have to see an eye doctor. But what I normally advocate is that see your doctor while you can still see, not when you can no longer see.
See your doctor while you can still...
Of course, while you can still see, because that is when you can actually get the best help. Now, as for the different category of eye care professionals, the scope is quite wide. We have the ophthalmologists, we have the optometrists, the ophthalmic nurses, and the opticians. Now, these four categories of eye care professionals, of these four, only two actually do consultation with their patients, and that's the ophthalmologists and the optometrists. Others work under supervision. So you find that the ophthalmic nurse works under supervision, and then the optician also works under supervision. So he sees each one of them must be working on the instruction of these other two eye care professionals. So the optometrist is the primary eye care provider. In an ideal situation, you should see the primary eye care provider before you see any other person. And so it's the entry point into the eye care chain.
Okay, I'm a bit curious to know the way you eye doctors sound, you know. Do you suffer what other professionals suffer, Dr. Madakolam? Every profession grapples with the problem of quackery. How is that among you? Do you face that challenge?
Oh yes, of course. There's no medical practice or aspect of medical practice that is completely free from quackery. Just as my president mentioned, the optician is just a technician. He's not a doctor. He's not an eye doctor. All right. So what happens is that some persons patronize the opticians, thinking they are the right persons to examine their eyes and all of that. So that's quackery, because they're not trained to do that. So optometrists are the first point of call, the first set of eye doctors you should see. That if have need, they will now refer you to see the ophthalmologist for further care. All
right, our time is virtually up, but I think I'd like to hear maybe 10 seconds from Dr. Okono. What would you recommend for government to do to help us in this matter of eye care and prevention of blindness?
Government should take the leading role. currently government is not living up to its expectation as the driving force in terms of delivery of eye care services in this country. And I make bold to say this because from experience I realize that government is taking a backstage instead of leading the whole process. Secondly, government should create a level playing field for all eye care professionals to practice their scope to the fullest. And that's what is expected of any responsible government. Thank you.
All right, thank you very much. That is actually the much we can take in this package tonight, and we'll have just enough time left to appreciate our guest. Dr. Ozi Okonokwa, President, Nigerian Optometric Association. Thank you.
Thank you for having me.
Dr. Orwell Maduakalam, Member 2018 World Sight Day Planning Committee. Thank you.
Thank you. It's been my pleasure.
And on behalf of the Nigeria Today crew, I thank you for being a part of it. Remember, Nigeria Today shows every weekday, same time. You can also watch any edition online at www.youtube.com/NTA News 24 Hub. My name is Kande Daniel. God bless you.